Hello, I'm Dr. Herman, and thank you for letting us come into your home and watching this brief video. This is a story, a real patient story that we wanted to share with you today. The patient next to me, his name is Mike. He lives about 2 hours, close to 2 hours west of my office in South Florida. We're in Fort Lauderdale. He comes over from Naples, Florida. And you started with me probably about, I don't know, 6-7 weeks ago?
Yes.
Yeah?
6 weeks.
And he found me through the internet like you are right now. And you came to me for a thyroid condition, hypothyroidism.
Yes.
And other symptoms that you had felt before we got started?
I had all kinds of issues for the past 4 years. I basically retired because of my conditions. I had fatigue, depression, a little bit of anxiety, major sleeping problem, constipation, brain fog, no memory.
Cold hands and feet, you said? The
yes.
hands and feet were cold?
Yes. I had my hands and feet cold, but you know, and with that, I went to many doctors.
What kind of doctors?
Psychiatrist, psychologist, thyroid doctor, you know, blood test every month, you know, and I was on medication, very strong medication, such as lithium. I was taking 1,200 to 1,800 milligram of lithium, 450 milligram of Wellbutrin, 175 milligram of lamictal. That's the poisonous all. Okay, I was taking. I mentioned I was taking Ambient 12.5 CR for sleeping. I was taking Centroid, which they changed to Armor later on. Basically for.
I'm sorry, and what you said was, and what I saw with your labs actually were within the normal range.
Yes, my lab test results were.
Even normal. Though you were feeling.
Terrible.
Not so good and taking
not so good.
A boatload of medications.
I was feeling crap, terrible. I wasn't functioning. I wasn't living. I was just going through the day's routine. So basically, by coming to, since I start coming here, I fully cooperated with Dr. Herman. Dr. Herman found out about my dental issues. Immediately I went to dentist and I took care of the dental issues, and I still have one left, one issue. I changed the diet immediately. I changed the water. I take the supplements, which Dr. Herman recommended. I reduced, the most important of all, I reduced my medications by 80%.
80%. The lithium is no more, right?
I don't take no lithium.
That is awesome.
Wellbutrin is reduced from 450 to 300.
How are you feeling? So depression is no longer?
I don't have depression and no anxiety.
That's good. The brain fog is?
Brain fog is lifting. I'm not saying I'm 100% better, but I could say I'm 70%.
That's 70%, and we've been together for
6 weeks.
6 weeks.
Yeah, we've been married 6 weeks.
And it's just been, you really, I appreciate you because you really jumped on board and did everything that we
Well, it's a teamwork. If you want your health back, you have to cooperate with your doctor. The difference between Dr. Herman and other doctor is Dr. Herman wants to go to the source of the problem to fix the fundamental problem. The other doctors, they only want to fix your symptoms. So your fundamental problem still exists.
But the problem with those physicians' treatments, their protocols, they gave you all the medication, but you still had the symptoms. So
absolutely.
It never covered it up.
They never fundamentally attacked the main problem, the cause of the problem.
So some of the things that we found with you, with Mike here, was that he had viruses and parasites. He had a very toxic liver, not because he's an alcoholic, but medications will do it, and different things in the environment. I talk about this on my thyroid video, Hope for Your Thyroid. You can recover your thyroid naturally. The liver was toxic. He had infections, and still there's some to clear up, infections and heavy metals in the body. And we're working diligently, and I appreciate him because he is working very diligently to do what we require to be able to see, you know, to see this kind of amazing, quick outcome and reversing these different psychological and neurological and endocrine disorders. So there have been enemas that had to be part of your program.
Coffee enemas.
And it's wonderful. It's really great. To see
bottom line is this: if you want to live, okay, you deal with Dr. Herman and people that they have the same belief as Dr. Herman. If you want to exist, you go to our traditional doctors. You go through day-to-day motion, and you don't have no real enjoyment of life. Okay, you can't ride your bike. You can't enjoy riding your bike like I couldn't anymore, because you eat breakfast and you go to sleep. You eat lunch. You eat food in order to get more energy. I don't do that anymore.
But you would eat and fall asleep, so you had no more energy. You were feeling fatigued after.
Absolutely.
And that's no longer.
But you couldn't sleep. We wake up every hour before, and now I'm getting pretty decent sleep. Am I 100% better? No. But am I 70% better? Yes. With 80% less reduction of my medication,
awesome.
Traditional medication.
Awesome.
Okay.
Excellent.
So
we're going to get the other.
Well, thank you very much.
The other % will be fixed. You're welcome.
I'm very grateful for what Dr. Herman done to me personally. I'm so confident about this treatment that I can have my phone number. Anyone wants to talk to me personally, anyone wants to get more information. This is not about Dr. Herman. This is about the philosophy of Dr. Herman. Okay, the approach he takes toward healing people. That's the bottom line.
Getting to the root causes.
Getting the root cause, healing. And it has worked for me, and I can share my experience with you because I want the best life for everybody.
Yeah, thank you.
You're welcome.
Thank you.
Anytime.
Thank you. So we appreciate you for letting me come into your home and sharing my story. And you can always reach us via phone at 954-370-3100. You can reach us also toll free at 1-855-270-HOPE, HOPE. And thank you again.